Fox News is committed to your health, and one way you can take care of yourself is by going to your regularly scheduled checkups with your primary care physician. Dr. Donnelly Howard from USA Health is joining us now to talk about the importance of health maintenance. Dr. Howard, thank you for stopping by. This is a very important topic.
You are welcome. I'm happy to be here.
Okay, so first and foremost, because it can be difficult, whether you're new to the area or your physician is retiring, how do you find that primary care physician?
Well, there are lots of resources. You can go online and just do a Google search of primary care physicians in the area. And the good thing to know is that there's somebody specific out there that fits you, and you may see a primary care doctor that might not have the same values as you. So it's really good to find somebody that fits your personality and has similar values that you do.
Mm-hmm. Yeah, your primary care physician is going to be the one doing those screenings, the first to make sure you're getting those more accurate diagnoses. Can you talk a little bit more about that relationship?
So we know that patients who establish care with a primary care doctor have better health outcomes. They have lower trouble with diseases, and they tend to live longer. It's really good to have a primary care doctor for two reasons. One reason is to treat medical conditions that have already been diagnosed, but the other thing that we know is so critical that a lot of people miss out on by going just to an urgent care or someone quick is that screening and preventative measures are so important long term. A lot of people may have underlying conditions that they don't know about. An example of that is high blood pressure or diabetes. These diseases can live in your body for many years, and we know that type 2 diabetes patients may and frequently have that for up to 10 years doing damage before they ever get diagnosed. And these diseases can be silent killers, so even though you don't feel bad, we know that they do damage a long time before they get diagnosed and treated in patients who are not established with a primary care doctor.
Yeah, and talking about how often those visits should be, because guidelines are constantly changing. How frequently should you have those checkups with your primary care physician?
Yeah, that's a great question, and the answer is it's different for everybody. For young, healthy individuals, younger than 40, it's a good idea to go in and have a checkup, have some basic lab work done, have your blood pressure checked, sometimes cholesterol. And if you're healthy and don't show any signs of disease, it may be 3 years before you need to come back. But for individuals over 50 years of age, we really recommend at least one annual general health maintenance exam. And for people with known conditions or at risk for developing conditions, sometimes that time frame becomes a little more frequent. So people with a lot of conditions that need frequent monitoring, sometimes 3 months or 6 months is more appropriate.
All right. Well, thank you so much, Dr. Howard. A wealth of information you've provided here. Appreciate you stopping by.
Thank you so much.
And you can watch this interview with someone you know, share it. We're going to have it on our YouTube channel there shortly. Look for that icon and subscribe, because you're missing out when we post new stories on YouTube.